This week's viewer question is, what are the risk factors for high cholesterol? And with us we have our expert physician.
Another treatable silent killer. What are the risk factors for it?
One of the major risk factors for high cholesterol is genetics. I mean, you know, it runs in families. You should ask your parents or your siblings if they have been diagnosed with high cholesterol or not. Another major risk factor is diet. You know, look into the diet of that, you know, eating out, which is predominantly high cholesterol, and the lack of exercise is also a major factor, and obesity as well.
And this is another thing. There are a certain percentage of patients that are non-diet responsive. In other words, you can eat a perfect diet and your cholesterol will still be high. You can thank your parents for that. But the thing is, it's now an eminently treatable abnormality. The drugs are so effective.
Right.
Tell us a little bit about that.
Yes, I mean, we have statins. I mean, statins are the most prescribed drug in the world. I mean, and it really helps with lowering your cholesterol and
saving lives. You should point out
studies have shown that the lower the cholesterol levels are, the lower the risk of having a heart attack and stroke. And time again, with every statin and every anti-lipid drug that came out of the market, I mean, they have shown consistently that it has shown to save lives. So,
and these medications are long-term medications. They're not meant for 6 months, or your chances are if you need to be on a statin, you're going to need to be on it long term. Yeah.
Right. I mean, we could stop the medicine and check the cholesterol, and I've done that with our patients if they really wanted to go off of the statin or any anti-lipid drug to prove themselves that it's something that they have to take,
but
and this is not something related to the diet or something they can cut corners in their the lifestyle. I think they should continue.
Statins are great drugs. They're a blessing for all of us, and I take one, and I'm very thankful for it.
There you have it.
And there you have it. Never had a heart attack. If you have my father did it in his 50s. If you have a question you'd like to ask on Health Talk, please contact Vicki and me at healthtalk@oralhealth.org.